Today we are going to be doing low back points, which are mostly governing vessel points and urinary bladder. First time probing the area with alcohol, sanitizing. Now I'm opening sterile disposable needles. Starting with governing vessel 4, which is below the spinous process of second lumbar vertebra, and to find it we put our hands to the last ribs and bring our thumbs together, feeling for the second lumbar vertebra spinous process, going just below and inserting perpendicular. Governing vessel 4. Next to it, 1.5 tune, we have urinary bladder 23. I'm moving 2 fingers, which is 1.5 tune lateral, going perpendicular, urinary bladder 23. Next point we are looking for is governing vessel 3, which would be point between spinous process of lumbar vertebra 4 and 5, and to identify that vertebra we place the hands on iliac crest, moving thumbs together and feeling for the 4th lumbar vertebra, its spinous process, and going below to insert needle in governing vessel 3. Perpendicular insertion. Now going 1.5 tune lateral from governing vessel 3. We do the point urinary bladder 25. Perpendicular insertion. Next point will be urinary bladder 32, which would be second sacral foramen. And to find that point, we identify posterior superior iliac spine and moving towards the governing vessel, moving lateral and feeling for the sacral foramen, the second sacral foramen. Inserting the needle, perpendicular. The next point will be urinary bladder 31, which would be first sacral foramen, just above urinary bladder 32. Again, perpendicular insertion. And same level as urinary bladder 31, we have urinary bladder 27, which would be 1.5 tune at the level of First, sacral foramen. Perpendicular insertion. And finally, our point urinary bladder 53, which is 3 tune my 4 fingers, same as patient's 4 fingers, from the midline governing vessel at the level of posterior superior iliac spine. Check. Perpendicular insertion. To make our treatment most effective, we are going to use needles on both sides, bilateral treatment, going for urinary bladder 23, urinary bladder 25, urinary bladder 31, '27, '32, urinary bladder 53. And again, for teaching purpose, I'm going to mark those points and go over them once again. Governing vessel 4, urinary bladder 23, governing vessel 3, urinary bladder 25, urinary bladder 31, urinary bladder 32, urinary bladder 27, and urinary bladder 53. The trick to remember mnemonic technique is to say to yourself UB23 between 2 and 3, lumbar 2 and 3, and UB25 between 4 and 5. Also, we can think about governing vessel 4 trying to squeeze itself between lumbar 2 and 3, and governing vessel 3 is trying to fit between lumbar vertebra 4 and 5. Couple of paravertebral and midline points at the upper back. Once again, I'm sterilizing the area with alcohol. And starting with governing vessel 14, which would be below the spinous process of cervical vertebra 7. To identify, we ask the patient to extend the neck. Please extend your neck. And flex. Excellent. The last spinous process which moves is the C7. We are going right below it and inserting needle, perpendicular. right below the spinous process of C7. The next vertebra would be thoracic vertebra 1, first thoracic vertebra, and the point we are going to needle is urinary bladder 11. We are moving 1.5 tune lateral from the spinous process of thoracic vertebra 1, and inserting the needle oblique towards the governing vessel. That's urinary bladder 11, influential point for bones. And to make the treatment the most efficient, we're inserting urinary bladder 11 point on both sides, oblique, medial. And for teaching purpose, I mark governing vessel 14, which is below cervical 7, and urinary bladder 11, which is at the level of lower border spinous process of T1, thoracic vertebra 1. Now, after the needles has been inserted for 20 minutes, I am removing them one by one and placing in disposable needle container. At the same time, I make sure that there is no bleeding from the insertion points, and that's why I'm having that cotton ball in my hand. I'm using one hand to hold one needle, not taking more than one needle per hand. Safety rules. Double checking for any bleeding. There is no bleeding after the needles taken out. That was upper back and lower back points to treat lower back pain from governing vessel and urinary bladder vessels.